So I started our high-risk breast cancer clinic, or a high-risk genetics clinic at Advocate Christ, and here we see patients who have high-risk genes such as Dr. Williamson, and we counsel them and discuss different ways to either detect or prevent cancer from occurring. And so as she discussed, she does have that BRCA gene, and with the BRCA gene you have a much higher risk, and I'm quoting roughly 60 to 80% of having an increased risk of breast cancer or ovarian cancer or pancreatic cancer in your lifetime. And so as Dr. Nikita mentioned, she decided to take more preventative measures in having a prophylactic bilateral mastectomy, as well as having her ovaries removed. When I'm talking to different patients, and some of them opt not to have their breast removed, they do more intensive screening, and that will include such as an MRI, alternating with a mammogram, or even seeing a oncologist to have her ovaries removed. And so many patients, like Dr. Nikita Williamson said, hey, I'm going to take the measures and have a prophylactic mastectomy because that can actually help reduce that risk of breast cancer occurring as low as possible, but it is not completely zero. And so I want to take a shift here, and because she did everything that she could to reduce that risk at age 39, but unfortunately she was diagnosed with breast cancer. Right. Can you share a little bit more about that experience?
Right. So again, I thought I was being proactive and, of course, taking control of the situation by jumping ahead of it. And even with the information I knew as being a provider, I thought doing that prophylactic procedure would bring my risk to almost zero. Almost zero is not zero. So I was diagnosed with breast cancer 2022 by self-breast exam. I found a lump. I went to my OBGYN, and as many, she knew my history, so she was like, maybe it's just a lymph node, but I'm gonna send you for an ultrasound, which surprisingly I got in the next day. And that little feeling that you get when you always know that you're BRCA, and you go get these ultrasounds and stuff, they always find something. So I thought it was a usual, I found something, but it's pretty benign. In this case, she came back and said, no, it's malignant, but we need to probably do a biopsy. 7 days later, I got a biopsy on a Friday, and I remember this very clearly because I can see my results because I'm on staff. But I stalked it all weekend, and just when I did get the results, I remember sitting on my couch just thinking, who do I call? Who exactly do I know? And then something said, call Shayna. And then I remember calling Dr. Rozelle, and she was like, can I look at your chart real quick? And then all I heard her say is, oh yeah, we good, we got this. And so that makes my story unique, being a breast cancer, a person with breast cancer and the breast cancer gene, trying to prevent this measure from even happening and still getting breast cancer. So then that's when my friendship with Shayna become more of a colleague to an actual provider-patient relationship.